So recurrent respiratory papillomatosis is a non-cancerous condition. However, it affects the quality of life of patients. It is mediated through the HPV virus, specifically HPV 6 and 11. And it affects the quality of life. It affects patients of all ages, particularly younger patients. And so recently there has been development, significant development in the tackling of this condition through systemic therapy. We've used VEGF inhibitors off-label, specifically bevacizumab, and that works very well as far as a non-surgical approach. Recently, we had the first approval of a DNA-based therapy, which is really an immunotherapy stimulating the immune system to attack the viral-mediated proteins. The agent that was approved is zopapogene or Pepsi-Mayos, and so that's now available for patients, which is very exciting. Another agent that was tested in this agent is the agent in question here, which is the INO-3107. That is also a DNA-based therapy. And at this ASCO meeting, we're presenting the information related to the B-cell responses, specifically to giving this agent or this vaccine, tumor vaccine really, to patients with this condition. So as we know, the T-cell responses are really playing a major role in, we think, inducing immunologic effective responses for these tumors. The fact that in this ASCO meeting we could show that also this treatment induces specific B-cell responses, and those are induced and found in the blood, but also in the tissue for the few patients who were rebiopsied. And the increase in these B cells seems to correlate also with the clinical benefit to giving this agent. In other words, this correlated with the lack of need of surgical resection over the first and second year and beyond the second year. That indicates that probably these B cells are enhancing the T cell activity and presenting antigens, perhaps to the T cells, to essentially improve the clinical activity of this agent. So we're very excited about this. There needs to be more work to further characterize this immunologic response, but this is a unique opportunity in enhancement of the responses by these treatments to these patients, and we hope that more and more options will be available for these patients.